Money FM 89.3, best of workday afternoon. Health Suites with Clarissa Montero on Money FM 89.3.
Good afternoon and welcome to Health Suites on Money FM 89.3. I'm Clarissa Montero. On the phone, I am joined by Dr. Lam Bee Lan from Ageless Medical. We find out more today about Botox and filler injections to define and rejuvenate the body. Dr. Lam, welcome to the show.
Hello, Clarissa. We met about a year ago online.
I know, right? It's been a year. But,
Yes.
so much has happened in the year. And I also know that so many people have gone back to you since I last spoke to you.
Absolutely. I think it is really an unusual year, 2020. A lot of us remember it for that.
I think we'll remember it for the rest of our lives. Now, we've talked about Botox and fillers before. Last year when I spoke to you, we talked about it in the face. This year, we're talking about it for the body. Can you tell us more about that?
Now, botulinum toxin, which is, the term used for this toxin, we know that it is a toxin and it is a poison. But botulinum toxin today is a synonym of cosmetic treatments, beauty, and well-being. And it has been a very long journey from when botulism was first described as a disease caused by the toxin. So how the botulinum toxin was being isolated in the laboratory to when botulinum toxin is now being clinically used to treat both medical conditions and for cosmetic use. It has been a very long journey. For the past 2 to 3 decades, there are numerous clinical trials and studies done for the use of botulinum toxin A on various muscle groups in the human body besides the face. So we're going to discuss about this today. So what exactly is botulinum toxin type A? Do you know, Clarissa?
No, but you're going to tell me.
Yes, okay. So actually, a lot of people are not aware, botulinum toxin type A is a biological agent. It is produced naturally by the bacteria Clostridium botulinum in the laboratory. And how it works is that the toxin will act on the junctions between the nerves and the muscles. It acts by blocking the release of a chemical known as acetylcholine. And this chemical is required for muscle contraction. So when botulinum toxin blocks this acetylcholine, the muscles cannot contract. It therefore relaxes. So if you inject it on the face, it will relax the muscles of the facial, of its facial expression, so you don't have any frown lines or crow's feet. If you inject it into the other parts of the body, for example, the neck or the calf muscles, it can therefore relax any muscular contractions. So as I've mentioned before, since about 2-3 decades ago, botulinum toxin A has been used widely worldwide, not only for cosmetic use, but also for therapeutic use. Dysport, which is another brand of botulinum toxin A, besides Botox, was first introduced in Singapore by Ipsen in 1999 for its therapeutic indications. And here we're going to discuss, briefly mention about all these. It is used in the treatment of conditions like blepharospasm, a very long name to mean abnormal contraction or twitch of the eyelid, hemifacial spasm. Sometimes you see patients or people walking around and they're very frequent involuntary contractions of the muscles in half of their face, or for spasmodic corticolase, which is the abnormal muscular contractions of the neck muscles, or even in pediatric patients, with cerebral palsy, they've got spasticity in their limbs. Dysport or botulinum toxin A has been injected into these muscles to relax them, to actually help these patients, to alleviate them of the pain and discomfort they experience because of these abnormal muscular contractions. And it is life-saving because it greatly improves the qualities of their life.
I think that if you can stop somebody's nervous facial tic, they're going to be very, very thrilled. It's
Absolutely.
Right? I mean, the thing is, you can't control it yourself.
Yes.
So if an injection relaxes that muscle and you're not ticking and twitching, that give you so much confidence.
Absolutely. And it's because of these therapeutic indications, when they injected it, for example, in hemifacial spasm, half the face is twitching, when the doctor injected into the half face that is twitching, they find that the lines are gone on that side of the face. And that's how botulinum toxin A, Dysport or Botox, were subsequently being used for cosmetic use. That's how it evolved, actually.
Right, okay. So let's talk about some of those cosmetic uses. The silhouette of the neck. Now, no matter how many facials you go to and how hydrated your face is, your neck doesn't lie, and it is a truer indication of your age. And most of us ignore the neck.
Yes. You're absolutely right. There is in fact, the neck and also the skin on the back of the hands are the two most over-neglected and underappreciated areas of our body. Do you agree with me?
Absolutely.
Yes.
So these injections work in these areas?
Yes. Now, botulinum toxin can be used besides the face on other parts of the body, as you've rightly mentioned, turkey neck. Now, turkey neck are vertical muscle bands that we see in the neck of usually older patients, okay? Besides the turkey neck, very commonly we use botulinum toxin to inject into the jaw muscles. This one is served two purpose. Some patients, they have bruxism, which is they tend to grind their teeth when they sleep at night.
Mm-hmm.
I have that problem. So when you grind your teeth when you sleep at night, it can cause cracks in the enamel of the teeth. So when you inject Dysport or botulinum toxin into the jaw muscles, you relax the muscles so you stop grinding. And besides that, when you inject Dysport or botulinum toxin into the jaw muscles, you can slim the jaw muscles to create a V-shaped face. That is, all the craze now in Asian women, because of the influence of the Korean K-pop culture, they do that. They inject into the jaw muscles, and then they put some dermal fillers to augment the chin, botulinum toxin A into the calf muscles to slim the calves, to actually give you a nicer silhouette of the calf. And there's one last treatment, not one last, this is one of the other treatment that's actually US FDA approved. Dysport or botulinum toxin A has been approved to treat excessive underarm sweating. And this can be a big problem for many people, right? Because when you are going for interview, you are nervous, especially for the guys in this crisp-looking shirt, and then you were perspiring like crazy in your armpit, and then before you realize it, you are soaking wet with two patches under your armpit, and that's not exactly very
not
pleasant
attractive,
looking.
No.
Exactly. So it's actually excellent for treating excessive underarm sweating with botulinum toxin type A. The results have been amazing.
Interesting, very interesting. We're speaking with Dr. Lam Bee Lan from Ageless Medical. How long do these injections last?
Now, for botulinum toxin treatments of the body, generally speaking, for example, for the masseter muscles or jaw muscles injection, calf muscles, usually patients will come back every 4 to 6 months for repeat treatment. The treatment generally lasts up to 6 months, but then again, it depends on the muscle mass we see in the patients. For example, men, we have bigger muscle mass, so they may last a bit shorter. Also, the lifestyle and habit of the patients. If they're always in the sun, if they are very, some patients are very always animating, they're always full of expression in the face. Of course, it tends to last shorter, but generally it's about up to 6 months.
Okay, so if it's up to 6 months, would you say 4 months as an average is a good average?
Yes. So some patients, if they do not want to have the results totally wearing out, and then, they have big calf muscles 6 months ago, then within a month, the muscles become smaller, and then suddenly become big again, or, square jaws, small, becoming very small after injection, and then you didn't come back for injection, become very big again. Some patients may come back a little bit sooner, maybe every 4 to 5 months for repeat treatment, so that they can maintain constant good results.
Okay, now I'm understanding. Let's talk about fillers. A lot of people use fillers because they're losing volume or elasticity in the face. And we've talked about fillers before. So where else can they be used other than the face?
Now, as you've rightly mentioned, Clarissa, as we age, we lose volume from our face. So dermal fillers are commonly used to restore the volume loss in our face. Now, by strategically placing the fillers in the correct place, in the correct plane, we can also use hyaluronic acid fillers to smoothen lines and wrinkles, to improve and to contour the face, and to actually sculpt the face. As we both agreed earlier, that two of the most over-neglected and underappreciated areas of our body, which unfortunately also very often reveal our age, are our neck and the skin on the back of our hands. Look at Madonna, for example. She has gorgeous face that doesn't seem to age. Her age is freeze at 30 years old. If you look at her face, but if you Google her hands online, you can see that her hands are the hands of a 55 to 60-year-old woman, but her face is that of a 30-year-old woman. Why? Because these two areas are often neglected by us. Now, the skin on our neck and the back of our hands are generally thinner, they're more delicate, and there are very little fats and subcutaneous tissue. And also the hands, the skin on the back of our hands have very few sebaceous glands as compared to our face. And we know sebaceous glands or oil glands produce sebum to protect our skin and to keep it hydrated. And of course, if you are not protecting the hands, you're always exposing the hands to the sun. And as you age, it loses the HA and also it becomes drier. Now, with this pandemic, we are always washing our hands, right? And definitely it will worsen the skin on the back of our hands. It causes it to be even more dehydrated. Now, we also know that hyaluronic acid is actually found in many parts of our body, on our skin, in the vitreous jelly of our eyes, connective tissue, joints, muscles, and so on and so forth. And if you think about it logically, as we age, we lose native hyaluronic acid from our skin. Now, the function of HA, or hyaluronic acid, in our skin is to absorb more than 1,000 times its weight in water. So you can imagine when the HA in our skin absorbs water into our skin, it will cause the skin to plump up and look more hydrated. But when we start to lose this HA as we age, the skin is unable to hold the water, unable to absorb the water. It therefore becomes dehydrated. It looks crepey. And if we replace HA loss by injecting it, for example, you inject Restylane hyaluronic acid, such as the excellent Restylane skin boosters, into the dermis layer of the skin, the injected HA will then start to draw water again into the dermal matrix. It will cause the skin to swell up. It makes it look even more plumper, radiant, and more hydrated. And Restylane skin boosters are excellent products that not only hydrate the skin on the neck and the skin on the back of our hands, it also, as I mentioned earlier, acts to improve the skin elasticity. It stimulates the growth of collagen. It makes the skin look radiant, porcelain looking, and healthy looking.
Okay, so this
another
is
point. Yeah, correct.
very
Sorry?
important. This is a very important point. You said the skin behind, on the back of your hand is very
Yes.
thin. There's not a lot of fat there. So would an injection filler there be more painful?
No. Surprisingly, injection on the skin at the back of the hands, I think it's actually not painful at all. You can try if you want to. There are less nerve endings, really. There are less nerve endings on the skin at the back of the hands. On your palm, yes, it's very painful. But the skin on the back of the hands, you'll be surprised. It's actually very little pain to no pain.
What about your neck?
You can try. Neck, a little bit more sensation. Neck can be a little bit more discomfort, but generally, it's also not as bad as your face, actually.
Really? So the face is the one that
Yes.
hurts the most?
Yes, you're absolutely right. But usually, even if you're going to inject fillers into the face, we'll give you local anesthesia. Sometimes it will give you nerve block. So you actually feel very little discomfort when we're performing the treatment.
Okay, now before we run out of time, one of the questions I would ask is hands, necks. Also 4 to 6 months between jabs?
So for Restylane skin boosters, for example, you inject into the hand and the neck. There's a standard protocol of 2 to 3 sessions at 4 weeks interval. Thereafter, patient will repeat the treatment once every 6 to 12 months, depending on the skin condition, your lifestyle and habits. Why? Because the hyaluronic acid we choose for the neck and the skin and back of the hands, generally they are less viscous, they are thinner, so they can spread out more evenly and they're more easily moldable. Because of that, they tend to last a little bit shorter. There need to be a startup protocol of 2 to 3 sessions at 4 weeks interval, and thereafter you just repeat once every 6 to 12 months.
All right. So in the beginning, there's more treatments, and then there's a longer down. Okay, that's very, very useful information. And really, a lot of people don't realize it. If someone as big a star as Madonna doesn't realize her hands give away her age, then I think most of us don't realize it, right? So it's good that we brought it up today.
Yes.
You go in and see your aesthetic doctor. Do your hands.
So that your diamond can bling brighter. Yeah.
That's true. That is also true. So it is a better platform for all your beautiful jewelry. As usual, I've enjoyed talking to you. I always enjoy talking to you. We've been speaking with Dr. Lam Bee Lan from Ageless Medical. Doctor, thank you for the information. Thank you for the time.
Thank you, Clarissa.
I'm Clarissa Montero for the Workday Afternoon. This is Money FM 89.3. To listen to more great interviews, download our podcasts at moneyfm893.sg or download the SPH radio app available on Google Play or the App Store.